Hello, Keerthana. How are you?
Yeah, I'm good, ma'am. How are you?
Yeah, I'm good too. Thank you. And
Yes,
happiest
ma'am.
congratulations on this
Thank you, ma'am.
exam. So you are a proud member of this prestigious Royal
Yes,
College. Yeah.
yes, ma'am. Yes,
Yes, I know you must be feeling very, very happy. Even I'm
yes,
I'm
ma'am.
so happy for you and for your result.
Thank you, ma'am. Thank you very much, ma'am. I should really thank you because without you, I don't think I would have passed this exam, ma'am. Because at the heat of the moment, I had just 2 months before the exam. At
Yes.
that point of time, I decided to give the exam, and I did not know which course to join and where to start. So I was just scrolling the YouTube, and there I found your videos, and
Right.
that is how I know about you actually.
Oh,
And yes, ma'am, it all started from there. I should really
yes.
thank you, ma'am.
Yes, yeah, I'm trying to, yeah, I always try to post some important scenario
Yes,
on my YouTube.
yes, ma'am.
Yeah.
Mhm.
And like how did you start your journey? What tips would you like to give to your colleagues who will be appearing in the exam?
Yes, ma'am. So, ma'am, actually, I started just 2 months before the exam because that's only when I planned to give my exam in
Mm.
the May attempt. So, when I was just going through the YouTube, we had multiple courses. You obviously know everything.
Yes.
So, when I came to your course, your the main thing which was very important was your voice. Your voice is very sweet and it was very soft and very clear mainly. That is one very important thing which I liked. And without any second thought, I messaged you.
Yes.
So immediately I got a reply from you as well. So first, I joined your recall audio session,
Mm.
and you sent me your recalls, and I was able to. The other important thing is that, ma'am, all your recalls were within 10 minutes, which I feel is very important because you cover every important point in the history, in the examination, in the investigation, as well as the management options. So everything in 10 minutes is very important because during the exam time as well, this was very helpful for me.
Right. Okay. And like you had a partner, isn't it? For
No, ma'am.
practice?
Actually, I did not have a study partner because I started very late. I was not able to find a proper study partner, and none of my friends were also preparing for the exam. So,
Yes.
what I did was two things. I used to speak in front of a mirror because get trying to speak for 10 minutes. 10 minutes is a long duration to speak continuously. That was very difficult for me. So, what I did was I used to read your templates louder, and
Hmm.
that made me practice very because you send all the templates in the PDF format, which is very useful because we no need to take any notes, and that saved most of our time, ma'am. I should really thank you for that because preparing all those templates would have not been very easy for you, definitely.
Yes,
So
yes.
that those templates I used to
Yeah.
read louder. So that was
Right.
very helpful for me. And I used to hear your recordings, and because of your voice, was able to understand the empathy, which is empathy, and that helped me to deal with every patient. Though she's angry
Mhm.
or sad, I was able to deal with them. So this is how I started practicing, ma'am.
Yes, of course, there has to be some modulation in your voice because
Yes,
you will be
yes, that's very
getting
important.
stations of breaking bad news. So
Mm.
your tone has to be very empathetic and very
Yes,
sweet.
ma'am.
There
Yes.
has to be a clarity in your speech. And you were also very good, very hardworking. And even during the course, I think you missed few sessions, but
Yes,
still
ma'am.
you tried your best to be there.
Yes,
And
ma'am.
I always used to say that don't just read the templates, talk the templates, talk and talk
Yes, ma'am,
and
that's
talk.
very important, ma'am,
Mhm.
because we'll be doing 14 stations continuously
Mhm.
so we'll be running like a marathon. So what happens? Our brain will be exhausted definitely. So it's very important that we have to talk louder because at the same time, when the bell rings, 14 role players, at the same time, 14 candidates will be talking at the same
Yes.
time. So we'll have just a screen between us. So it's very important that our voice has to reach the role players and they have to reply us. So this
Yes.
was one of the instruction which the RCOG member gave us. Talk
Okay.
how much louder you can because
Right.
that is very important. By the end of 14 stations, I literally lost my voice.
Yes, yes. Because
Yeah,
that is a very valid point, Keerthana, because there is going to be
yes,
a
ma'am.
distance. You will be sitting on the table on this side, role
Yes,
player will be on the other side. So
yes, ma'am.
and also there will be some background noise. Because
Yes.
candidates will be presenting their cases in another cubicle, and
Mm,
all the cubicles are so close to each other. So yes,
yes.
very valid point for you, Kirtana, that
That's
yes, to speak loudly in the exam, right?
That's one very important point, ma'am. The other thing is that it has to be very natural. Just as we see, as if we see a patient in our OPD, how would we deal with them? It should
Mm-hmm.
not appear scripted. That's other very important thing. Which because every one of us will be preparing the cases through templates. It has
Hmm.
the history part, the
Yes,
investigations, and the management part. So
yes,
thing is that the more naturally you speak with the patient,
yes.
that becomes the conversation just that mimics as if you're in a natural actual OPD. That is what they're expecting. If at all, it means like in the history part, we should always take a targeted history. So in some cases, the family history and the social history is of not significance. So
Mm-hmm.
in that cases, we should definitely skip them because if
Mm-hmm.
we take those histories in that stations, it means that we're not prepared because they actually give that word in the question paper, take a targeted and focused history.
Yes,
That is very important, and this will also save a lot of time during the discussion part.
yes, totally agree.
Yes, yes, that is one very important thing, ma'am. And the other thing is that we should give role players time to answer. If at all we finish a station very earlier, it's very important to ask them if you have any concerns, please let me know. Because at that point, they will have a set of questions which has to be asked. They will ask those questions and they will help us to complete the scenario. Because in many stations, the role players, I attended my exam in Delhi.
Mm-hmm.
All the role plays were excellent. I should
Mm-hmm.
really thank them because in
Yeah.
many stations, they were very, very helpful, ma'am. In many stations, they really helped us actually. Because at the heat of the moment, we'll be running through the stations, we'll be missing many points. That is natural, and in that stress, it's natural to miss some points. But
Yeah.
if we ask such questions, they will definitely help us to go through and to complete the station. That is one very important thing I would like to
Right.
tell them.
Hmm.
Yeah, because always go with the role player's agenda. On seeing the question paper outside, we will think, we will have we should not have a single topic in your mind. You should have 3 to 4 differential diagnoses, and we should go with them. We should have open questions because that will help
Yes.
to come
Like
to a final diagnosis.
exactly, exactly. Like for
Yeah.
example, like if you have a preterm labor case, patient is with
Mhm.
tummy pain. So of course you will be asking about dysuria. How about your water
Yes.
works, bowel opening,
About the domestic
even
violence,
domestic
everything it has to be
violence.
asked.
Exactly, partner and
Yes.
support. Do you feel safe and happy with your partner? Like some questions to rule out domestic violence.
Yes, ma'am.
Exactly. And
That is one more very important thing I would
hmm,
say.
hmm.
Yes, ma'am.
Yeah, and so what final tips will you give? Like you said, you seriously started preparation in the last 2 months. So
Yes,
how
ma'am. So
you
what?
started? You went
mm,
module wise initially, and in the end, how did you cover all the modules?
Ma'am, what I did was I joined your 2 months fast track course. So
Mm-hmm.
I did not have enough time. So I had to quit my job for 2 months. I
Mm-hmm.
know it was a big decision, but we have everyone are spending lakhs for this exam. I
Yes,
should definitely admit that. So I had to
very
quit my
true.
job.
Mm-hmm.
Yeah, and then I just followed your module, ma'am, because I was in my home and I was preparing. Even before the exam, I just asked you, ma'am, I am planning to quit my job. Is it okay? Can I clear my exam? Because I was very
Mm-hmm.
much afraid to quit my
Mm-hmm.
job as well, because that was an important decision I had to
Mm-hmm.
take at that point of time. You really supported me a lot at that moment, ma'am. So what I did was I did module wise. So weekly we used to have 2 to 3 sessions, no, ma'am. So
Yes.
I tried to complete all the for that module. I used to complete all the topics. So
Mm-hmm.
at the same point of time, I'll try to read the guideline summaries as well, because I made sure if it's not a simulated patient task, if at all I deal with a structured discussion, I had to be good with the knowledge about the
Yes,
topic as well.
definitely.
So I just went through the summaries of the topics because reading the
Mm-hmm.
whole guideline would be very difficult in the short time. So I just went through the summaries.
Mm-hmm. Right.
So this is how I went, ma'am. I just went module wise. So we finished a class by March and April end, I think. So I had 15
Mm-hmm.
days of time in my May. So that time I did 2 revisions. I just went through the modules, ma'am. So I used to prepare, I used to talk only the difficult stations. So per day I used to do 5 to 6 difficult stations in different modules. Because
Yes.
doing the same module the same on one day is not that's not going to work, because we'll be having 14 stations, different
Hmm.
modules. So it's very
Yes.
important that if even though you're doing 5 stations, we have to do different modules, because that will help to process your mind at that point, at that during the exam time. That is very important, ma'am. So I did two revisions in
Yes.
the 15 days. For 1 week, one
Right.
to first revision, and the second week I did my second revision. And this is how I prepared for my exam, ma'am. And the other thing is, I would like to tell is that whenever we present cases, we used to present one case during a
Yes.
session.
Yeah. Yeah.
At that time, when the other person is presenting, what I used to do is that I used to have a notepad. So for the first two
Yes.
minutes, I used to write down the points which are all to be spoken during that station. So that is how I train myself during the 2 minutes, because I won't just prepare for my station, ma'am.
Hmm.
When the others are presenting as well, I'll be preparing myself. I'll be talking to myself. So these are all the points which we should speak in this station, and that
Yes.
is how I prepared. That is
Yes.
one very important thing I would like to say,
Yes.
ma'am.
Very good. Yes. And listening to other presenters is also very important because,
It's very important.
yes, because all of you are well prepared. You all have booked the exam. All of you are going for the
Yes,
exam. So the exam going candidates are full of knowledge and they're very
yes,
serious. I know you people
yes,
are like encyclopedia. So, because for us also, we have to keep ourselves updated. So, we
yes,
also keep
ma'am.
reading. If there's any new guideline, I also read, but I
Yes,
know my candidates who are going for the exam are definitely very well prepared because no one wants to like take the fail the attempt. No one, no one.
yes, ma'am.
It
Yes,
is
definitely, ma'am.
part three is like everyone wants to finish it in one go.
Yes. And this is
Yeah.
my first attempt as well. And
Yes.
I
Yes,
should
Keerthana.
really thank you. Thank
Yeah,
you,
yeah,
ma'am.
yeah. It was your hard work and your dedication as well.
Yes.
And you really worked hard. Yes, I know that.
Thank you, ma'am.
I'm very happy for you and congratulations once again, Kirtan.
Thank you. Thank you, ma'am.
Thank
Thank you,
you.
ma'am.
Thank you for
Thank you, ma'am.
coming here, for giving the precious tips. Thanks for
Sure, ma'am.
sharing these important tips, my dear. Stay blessed
Thank you, ma'am.
always. God bless you. Thank you.
Thank you.
Thank you.
Thank you, ma'am.
Bye-bye. Bye.